Well, good afternoon, everybody, and thank you for having me. As Sherilyn just identified, I'm a principal researcher at Queensland Centre for Mental Health Research, working across two groups for which there is a small intersection, the Forensic Mental Health Group and Military and Veterans Mental Health Collaborative. I'm also an adjunct associate professor at the University of Queensland. Now, I can't. Oh, there we go. Can everyone see that I've changed my slide?
Yes.
So I have a very kind of humble aims for today, which is really to present a case study of a piece of research I've been involved with for the last 6 years now, which is a sort of a complex study in many respects that I'll go into. And then I use it really as a bit of reflection around some of the issues we've faced and some of my thoughts around what sort of possible improvements or systems improvements could be made to research and governance. So really just looking at some of the challenges and opportunities within ethics and research governance processes in reference to a large linked data study, which is called the Partners in Prevention Study. So this is very much a story about research ethics and governance practice. I'm not talking about ethical principles as such. So the overview, I'll provide you a bit of a description around the Partners in Prevention Study, and then talk about some of the stats that describe the complexity of research and governance that oversights this project. Some detail around some of the specific legislative approvals processes associated with this project, and then kind of try and clarify, and this is what I was working in on the last minutes before joining the platform, what I see as some of the issues and ways forward. I'm very interested in hearing any thoughts or feedback from others, because I wouldn't mind publishing this at some point in the future. So the case study, as I said, it's a study, Partners in Prevention, Understanding and Enhancing First Responses to Suicide Crisis Situations. So this is a large population-wide data linkage study that's based in Queensland, and as I said, was established in 2017. The current data set comprises data for approximately 75,000 individuals in relation to approximately 220,000 suicide-related calls to police and paramedics. Identified over the period. It's starting to get old now. We need to update the study. This was from the beginning of 2014 to the beginning of 2017, so over a 3-year period. And at this stage, through multiple sort of steps of linkage, so we've sort of taken a compartmental, incremental approach to building the study. We currently have about 20 million rows of data in the data set. And of course, we would double that if we were to update it, or maybe even quadruple it if we were to update it to the most recent data available. Some of its broad features are it's a multi-agency study. So this is really important that it comprises both health and non-health administrative data sets, and it's multi-jurisdictional insofar as we have linkage to data sets within Queensland and as well with Commonwealth government agencies. And of course, perhaps at this point goes without saying that the study operates under a waiver of consent. So this is sort of a bit of a rough diagram just to give you a sense of the way in which the data set sits together. So the cohort was ultimately identified based on people who had a suicide-related police or paramedic contact in Queensland. We've subsequently just finished a linkage with Department of Defence data, so a Commonwealth agency, and through that we were able to identify both individuals within a cohort, police and paramedic cohort, who were defence members, either current or ex-serving at the time of a suicide-related contact, as well as a comparator group to that cohort. So the study in and of itself doesn't have an obvious global comparator to it, but when you look at sort of sub-cohorts within that, you can identify a comparator group. So there's about 70,000 individuals that comprise the Partners in Prevention cohort, and 5,000 approximately who sit in that defence-related comparator cohort. So the cohort now has therefore defined both by data that sits within the state of Queensland and data that sits within the Commonwealth. And the content data that goes with that linkage started with our Queensland Health data set. So for us, those are our emergency department presentations, our hospital admissions data sets, our public mental health services data set known as CIMA, the perinatal data collection, and the Queensland Death Register. And they sort of are managed by two separate entities, but there's a MOU that is between Data Linkage Queensland and the Queensland Register of Births, Deaths and Marriages to allow them to facilitate access to that data set. We obviously have then content data related to the incident details from QPS and QAS. We now have basic occupational characteristics from PMKEYS, which is the Department of Defence Human Resources Management data set. And ultimately, we've completed a linkage to link to MBS, PBS and National Death Index data, which updated our deaths data that we had from Queensland, the Queensland Death Register. Okay, so what are the stats? So you can see that there's several entities involved in that. So in total, since 2017, we've counted that the research governance process now comprises 54 separate pieces of documentation. And the breakdown of those 54 separate pieces of documentation is that it comprises 11 initial application documents. So these are things like your initial HREC or organisational approval document for an organisation that has a research approvals process that's not a accredited NHMRC ethics process, 25 amendment requests, 18 annual progress reports, and through that generated 4 integrated or interlinked project protocols in the context where each of those 4 protocols are considered to be the source of truth. So again, this just shows you a way in which these break down. So for the 5 agencies that we engage with for the project, they're subject to, they require us to submit 1 or more types of documentation, the most being to Queensland Health. So this includes review by 2 NHMRC accredited HRECs. So there's one that sits within Queensland Health and one that sits within the Department of Defence and Veterans Affairs. In addition to that, we have what I call the organisational research approvals, which are required from the Queensland Ambulance Service, Queensland Police Service, and the Australian Institute of Health and Welfare. We have the legislative and contractual processes. So within Queensland Health, that's the Public Health Act application, that's Office of Research Innovation managers. For AHW, that's the Public Interest Certificate. And for the Department of Defence and Veterans Affairs, that's a thing called the External Data Request Form. The other processes there within Queensland Health is something called the site-specific approval, which has to be done by site. And by site, that means hospital and health service district. And the study spans 2 hospital and health service districts. So there's 2 site-specific approvals that go with that. And for AHW, the other process is the technical assessment process, which underpins their research approvals process. Since the study was established, AHW has now implemented a feasibility questionnaire step. So that would add another entity to the AHW row. But also in Queensland, we don't have an Aboriginal and Torres Strait Islander Health Research Ethics Committee. So that's one less bureaucratic step that we would have within Queensland that other states would have to go through. So then in relation to that kind of structure, there are 6 mechanisms that deal with the legislative factors, mostly relating to the Privacy Act, but also relating to a few other acts of relevance. So in terms of the Privacy Act and the exemption to the Privacy Act that allows for the provision of a waiver of consent, as I said earlier, we have 2 of those from 2 different NHMRC accredited HRECs. But then we also have to separately, in some cases, document how studies relate to the application of the Australian privacy principles. And that's part of both the AHW research approval process, as well as the second step from the DDVA HREC. And for us, that's perhaps in part because when we went through our DDVA HREC process, that did not require us to account against the APPs. Now current approvals processes do require that to be part of their HREC approvals process. Within Queensland, we have the Public Health Act, which governs the use of health administrative data. As I said, that's managed by the Office of Research and Innovation. And then finally, there's what I call the secret step, obviously very important, but it's not one that researchers are directly involved with because the AHW does that on our behalf, and that's ensuring compliance with the Health Insurance Act and the National Health Act, and that happens through a thing called the Public Interest Certificate managed by the Australian Institute of Health and Welfare. So that's quite a lot. And I think the point, I guess, I wanted to make, and what I'm trying to think through here, is that it's obviously a really resource and time intensive process. That's not a problem in and of itself. If you know that it's going to be time and resource intensive, and you have the time and you have the resources, and you factor that into your research pathway. The problem that I want to raise is that the time and resource intensity has got to the point at which the process itself has broken down in certain key ways, such that what I've experienced through this process is a research and ethics process that's become, where the bureaucracy has become self-sustaining or self-perpetuating. So in particular, in this project, we've confronted situations in which we've had to submit project updates and our project progress reports, even though we have yet to receive the data. Similarly, we've also had to then start to submit specific amendment requests to extend the end dates of our studies due to those delays in receipt of data. And because the way in which some of these organisations are set up, you can see that from their point of view, the resources requiring to manage this process are likely taking away from the resources that they need to be providing us with the data. So you have this, like I said, self-perpetuating bureaucracy that's sort of taking resources away from the end point of providing data for the purposes of analysis and publication. And relatedly, I guess the second problem is that the management of ethical risks that this process is set up to sustain starts to produce its own ethical risks. And one of the really kind of tangible ways in which that can be seen is because we now have 4 sources of truth, because certain different organisations want reporting of the protocol according to their forms. And you obviously, do what you can to try and make that consistent. But of course, it becomes harder and harder and harder the more and more processes and protocols are added to that. And in that complexity, in that time-consuming nature of it, of course, you get to the point that somebody has to take on the specialist role of doing this from the point of view of the research team. In our research team, that's me. And of course, in doing so, you're decoupling the process of ethics and governance practice from the process of ethical practice of research. So your ethics process has become a bureaucratized process rather than one of dynamic engagement with the ethical conduct of the research. And when we engage with organizational committees, of course, there's this other risk of the slippage between what constitutes an ethical risk and what constitutes an organizational risk in the approvals processes. And not to say it's not really important to consider organizational risks, but it's really important that we're clear about the type of risk we're managing and why. And this really ultimately brings me back to the title of being caught in a loop, and to say you sort of get caught in a loop in one of 3 ways. We get caught in a loop in relation to dealing particularly with non-health agencies, and how the Privacy Act provisions and organisational legislation intersects with regards to applying a waiver of consent and releasing data to researchers. And even if that capacity and understanding exists within the research officers we're dealing with, they're often not the decision makers that provide the authorization for the release. And so we find ourselves going, you go up the chain and they don't have the knowledge or understanding of how these things intersect. There's a slippage of language in terms of what constitutes a risk, what constitutes an ethical risk, and what constitutes a legislative requirement. And you start to sort of spin your wheels. You also have the problem that within each organisation, where those organisations have multiple steps involved, that they serialise their process, right? So you know which step you do at which point in time. But when it comes to these multi-jurisdictional and multi-agency projects, they become co-contingent. So you can get situations where you have 2 organisations and they each want confirmation from the other before you can progress. Once you sort of get your tie break and one of them decides they're happy to be the first and the other's happy to be the second, you can guarantee that when you go to the second's going to require changes, which is going to require an amendment to the first, which again starts to generate its own paperwork. So what are some of the ways that I sort of think, we might like to think about ways forward? And this is a very wordy slide, and I realise I'm running out of time. I thought I would have not very much to say. I think the first comes with capacity building and communication. So a lot of these processes now are very well understand within the health sector, and there's a very large bureaucracy within the health sector that maybe not large enough, but still, well formed in the context of, how the Privacy Act worked, how waivers of consent work, etc. outside the health sector, this understanding can be patchy. And like I said, it can also be patchy within that organisation where the knowledge doesn't sit with the ultimate decision makers or authorisers of release of data. And so I really think that there's sort of a role that NHMRC can play in providing guidance and capacity across these non-health sectors, and which is really important because this is where we can start to make inroads in terms of furthering using data linkage to further our understanding of the social determinants of health. And certainly, you know, homelessness is a great example. I think there's some data sets that are starting to become available that allows us to link health data to homelessness data. But for a long time, you know, you do hit these kind of brick walls and blind spots when you start to try and investigate social determinants using linked data. But then a lot of the other kind of recommendations here around sort of thinking around those organisational and operational developments. And again, you know, I think I'll skip over this because I'm running out of time. The continued, you know, amongst practitioners and research practitioners, this continued belief that sort of research and ethics and governance is somehow incidental and rather than integral. And obviously, I suspect I'm preaching to the choir here on that. But as well, we need to sort of we need to continue, I guess, the pathway towards considering the specialties and the distinction between ethical research practice and research ethics and governance practice. And to sort of recognise the importance of specialists, both within specialist research and ethics governance roles within research teams, as well as within the research governance bodies that provide oversight. And I think as well, there's work and capacity building here because, you know, even things like the difference between a principal investigator and a coordinating principal investigator, those really helpful concepts in the organisation of research, but they're not really very well understood and not even very well sort of specified in the documentation that we often have to fill out. One final thing, when you do get these large data sets and to sort of avoid getting caught in a loop, I guess there's opportunity to consider the construction of cross-agency committees, not suggesting we reformulate the idea of an NHMRC research committee, those would exist, but really just project committees that bring together the representatives of the RGOs across the multiple agencies and the research and ethics specialists within the project teams to sort of manage and provide a consistency and efficiency across the process to avoid this getting stuck in a loop problem. And then finally, one of the things that sort of is, it seems like it's a lot of time spent, and I'm not sure what the benefit is around what would be useful to be automating processes for adding and removing investigators and changing study end dates. So that's it from me. Thank you very much. I think I have 1 minute left if there is any questions.
That was a great talk, Carla. Anyone have any questions? Let me just see. Basically, people are commenting in praise for those who rise to the challenges. Thank you, Gary said. Yeah, all I could think of when you first mentioned all of this was just, oh my gosh, it's giving me a headache to have someone be able to make sure everything is in place to be able to get the research done. And I know you're saying it's obviously a roundabout loop to make sure everything is ticked for it to continue. And is currently, I'm sorry if I missed this, is there someone that is specialized that has that type of oversight for such a large project that's spanning across different bodies?
Well, that's sort of become me, but not. I've come, you know, I've learned on the job as it were. You know, I have a research background. I have a PhD. I have a master's in maths and stats, but I don't spend any of my time on analysis. And one of the difficulties is that I spend so much time on you know, the paperwork that it's very hard to find time to actually publish from the paperwork. And again, being resource and time intensive isn't a problem in itself if it's understood and managed in that way. But certainly, I think there's a lot of tasks in my day that around the research and governance that I think could be simplified, and that would be beneficial. Like I said, mostly in terms of you know, progressing with understanding the intersection of social factors and health factors, and being able to sort of develop larger data sets and getting better information.
Yeah, because you have to understand what the research is doing as well as obviously the oversight. So it is pretty much a full-time job for someone to make sure everything is ticked. So intense. Okay, I have this Is it more a comment? Perhaps too cynical, but given this keeps happening, perhaps we should just stop funding these kinds of projects. I don't think Australia really wants to run these kind of studies. Is a comment.
Look, I mean, it's an interesting one because, of course, the legislation, you know, the Productivity Commission reviews, etc., do require our government departments to provide enabling environments. And they do. So, you know, my experience is that you don't get a no, or at least I don't get no's. But what I do get is a very, very long level of steps. And I guess to some extent, maybe, you know, you could say perhaps that's designed to kind of help promote attrition. So it's only the ones that get to the end that, you know, get the prize. But I think you've also got to realize, you know, especially in the current environment, you have relatively junior individuals with huge responsibility for keeping very sensitive data safe. And so I do really feel for people in these roles, because they're highly responsible roles that I think are not appropriately recognised for that, not appropriately remunerated, and not appropriately funded in terms of the teams required to do that properly. So yeah, and the risk is that you know, scandals, you know, these sorts of, you know, breaches of data cause scandals. So while I want to see things streamlined, I'm very sensitive to the hard work that those in the research governance offices do.
Yeah, that makes sense.